Good afternoon. Thank you for watching a live briefing for Monday, November 9th. We called today's special live briefing because we have had a lot of activity related to the coronavirus pandemic over this past weekend. And we want to take this time to bring you up to date on the latest and to be fully transparent about the situation here at Westminster Canterbury. When I'm done, Chaplain Velde will share a poem and a prayer with you today. But now for the update. As you've probably seen and heard in the news, cases of coronavirus are surging all over the country right now and around the world. I saw an article today that cases in long-term care in the U.S. are up 400% over the last few weeks. Virginia is seeing approximately 1,400 new cases each day, according to NPR. And the circumstances are very challenging. But I want to assure you that we are following all the recommended guidance and precautions to keep this community safe. And to do that, we follow all the latest guidance from the Centers for Medicare and Medicaid Services, the Centers for Disease Control and Prevention, and the Virginia Department of Health. Now, that becomes a challenge because these different agencies are all learning and adapting to the virus and to the pandemic. And so the guidance changes, and it changes frequently, but we continue to press on. Here on campus, in November, Westminster Canterbury has had 5 new cases of COVID-19 in residents and 6 new cases in our staff. We're here today to share with you what we can and ask for your help in taking care of yourselves and one another. First of all, please know, like I said, that we're working very closely with Virginia Department of Health to contact trace each time we learn that someone has tested positive. Anyone who has been exposed or affected in any way will be contacted directly. Now for the resident cases, 3 of our current cases, originated from the same area of Parsons Health Center, first floor of the Parsons Health Center on the west wing. Parsons Health Center, first floor, has closed all its dining and all its recreation, and all staff on those floors are taking adequate and appropriate precautions. Our 4th resident, which tested positive, I think on Friday, is an independent living resident. And this individual tested positive after going to the hospital. Let me say it differently. We expect this resident had little exposure to others on campus, and so for that we're very thankful. We did have 4 employees who worked with this resident when he went to the hospital. They're at quarantine, now at home. A 5th case is an independent living resident who was recently discharged from the Parsons Health Center after a temporary stay and is currently being cared for in the hospital. So the 4 residents that are on campus, we have 5, one's in the hospital. The other 4 are being cared for in our COVID-19 positive unit, which is on the 3rd floor of the pavilion. There's a dedicated team who will only work in this area until everyone recovers and returns back to their homes. We have a few other pending tests with residents. We'll update you more as we learn about those later in the week. Reminder, first floor of the Parsons Health Center remains in quarantine until at least Tuesday, November 24th. With each new case, that date moves. And so as of today, we'll be in quarantine on the first floor until the 24th. This also means that family visitation in all areas of Parsons Health Center is also suspended until November 24th, except in end-of-life and compassionate care situations. So more to come later in the week on that. In terms of employees, as I said at the beginning, we've already reported we have 6 current staff members who have tested positive for COVID-19. That's a total of 3 new cases yesterday and today. Let me summarize all 6 of those cases for you. The first is an employee of the Gables area of assisted living. This we told you about last week, and this person remains out. There are 3 staff members from Parsons Health Center and 1 private duty who also worked in the Parsons Health Center. And then we have a housekeeper also from Parsons Health Center who's tested positive. All of these employees are at home and quarantining and recovering. Additionally, we have a fair number of staff who are experiencing symptoms and are awaiting test results. In addition to that, several others have had direct exposure to either one of the staff members or residents who've tested positive or had exposure out in the community and are also quarantining per recommendations from the Virginia Department of Health. All in, it's a pretty big number of people who are out either awaiting tests or in quarantine. We need to do a couple things as a community. We need to discourage visitation. We need to discourage socialization and getting together as a group. We have an outbreak that we need to contain, and we need your help. It is possible, if we have more cases, we're going to need to shut down some of the programs. Perhaps that would mean dining, perhaps some of the other things. We're not there now, but if we have more cases, especially in independent living, that would be our next steps. Now, I also mentioned over the weekend, earlier, well, let me say that differently. Late last week, we learned that we had had a spouse of an employee test positive in the Child Development Center. There are 2 children. The spouse is not an employee, and then we have an employee, and we have 2 children who attend the Child Development Center. They are all in quarantine at home, but Virginia Department of Health has advised us that we do not need to quarantine or close any of the classrooms in the CDC. We just need to we can continue to operate as we have, but with a real close eye on how everyone's doing and on the situation. We're monitoring that situation closely, and we'll update you if anything changes. It's really important, as I was saying earlier, it's really important that we ask for your help at this point. We need to follow the guidelines for infection prevention, and that means all of us need to wear our mask at all times. We see a large number of residents with the masks down below their nose or not on at all, and we need your help. We need everyone to wear their mask, and if you see staff or contractors not wearing a mask, we need to know about it so that we can enforce it. You need to wash your hands frequently, keep your hands sanitized, maintain your distance. It's really important that if you're going to be around anyone for any period of time, that you keep your distance. That is the biggest determinant of whether or not someone's been exposed, is how close you were and how long you were with them. So if you need to be with some others, keep your distance. It will keep you safe. And then, please, stay home. If you don't feel well, stay in your apartment or your home and call the clinic, and let's get you tested or contact your physician. But we're really going to need your help. If you follow these guidelines, you'll stay well, and it will also make it much easier for all of us if and when others become ill and we need to contact trace. We would very much like to discourage visitation and social gatherings at this point in time. We need to contact trace and work to control the spread of the current situation. We've had a couple of independent living residents who have tested positive, and we're not sure exactly who they've been in contact with. So for the next few days, while we do that, it would be good. We don't want to lock everything down. You don't want us to lock everything down, but we need you to limit your interactions and especially limit any group activities. As I said before, in a case I'm sorry, I got ahead of myself. In a couple of the cases, resident cases that we've had, we have had visitors get exposed and or potentially be the source of the infection. We don't really know the difference at this point. Also, over the last few days, we've had several reports of visitors who have been on campus and have now been exposed outside of here, and they're concerned they may have exposed their family members. So what that should tell you is there's a lot of virus, okay? A lot of people are getting exposed. You need to keep your distance and keep the social distancing up and really limit our interactions. If we continue to have positive cases, we will have to suspend visitation, suspend dining in the promenade, and suspend other activities. We don't want to do that, and we need your help. So that's what I'm here today to do, is to ask for your help and help us control it. The cases of COVID-19 are increasing everywhere, and we have known for a while that we might see an increase in cases. Now that we need to slow down our socialization, slow down our visitation, and we need to control and contain the spread of the virus so that we can get back to life as we knew it, all right? So thank you in advance for that. We'll be back on Thursday, and we'll talk more about the specific situations and more about the different guidance, and if we have any more cases, I'll know more. I'm going to change gears now, and I want to talk about the power outage that happened early this morning. Around 1 a.m. Last evening, our security team reported a power outage at Westminster Canterbury in the surrounding area due to a vehicle that hit a transformer on 95. I want to say a big thank you to Emily Krause. She was our administrator on duty this weekend, and she coordinated with our campus teams to ensure everyone was taken care of. Residents who have emergency needs in independent living and assisted living were checked on by the nursing supervisors, and they were supplied with backups during the outage. By around 8 a.m. this morning, power had been restored to all areas on campus. Our glebe homes were the last to come back online. We appreciate everybody's patience as we waited for Dominion Power to restore power to everybody. A couple last things. You've probably noticed the work going on at the Cochrane Pond. The whole pond area is undergoing a rejuvenation project. It involves tree maintenance, overgrown plant removal, irrigation, improved lighting, landscaping, and more. We hope that we'll have Kathleen Pender here to tell you all about it on Thursday this week. And then also one last thing, in a memo that we shared over the weekend, we said we'd have a live update on Tuesday, tomorrow at 3 p.m. But because we decided to move it up to today, we will not have a briefing tomorrow. Our next briefing will be on Thursday, November 12th, again here at 3 p.m. on TV 970. In the coming weeks, our live updates, we're going to continue to try to bring you some updates from other departments around campus and make sure you keep up to date on all the happenings that's going on around campus. So more to come. That's all I have for you today. We'll be back on Thursday. We will be sending out a memo later today. This will be also up on the Touchdown and on the blog on our website. So if you want to share it with your family members, or if you missed this and you want to read it, you'll find all that on at those locations. Thank you all very much. I appreciate everyone's help and support as we work to contain this. Next up is the chaplain, Jenny Velde.
Good afternoon. Our scripture reading today comes from the Gospel of John, chapter 1, verse 5. The light shines in the darkness, and the darkness did not overcome it. May you find peace in this blessing entitled, Blessed Are You Who Bear the Light, by Jan Richardson. Blessed are you who bear the light in unbearable times, who testify to its endurance amid the unendurable, who bear witness to its persistence when everything seems in shadow and grief. Blessed are you in whom the light lives, in whom the brightness blazes your heart a chapel, an altar where in the deepest night can be seen the fire that shines forth in you, in unaccountable faith, in stubborn hope, in love that illumines every broken thing it finds. Please pray with me. Gracious and holy God, we thank you for your light that shines in us and through us, even when it seems we are surrounded by darkness. We know that your presence and strength allow us to bear the unbearable and endure the unendurable. Even when we are afraid or anxious, when we are weary or sad, your light is persistent, your love unending. Strengthen us for the road ahead. Meet our fears with your calm, our anxiety with your peace, our weariness with your encouragement. Bring your healing to all who are sick and your protection for those who care for them. May we care for one another, love one another, and shine your light with persistent and unfathomable faith. Amen. Please join us on Thursday for our next 3 o'clock live update.